Gay, lesbian, bisexual, transgender, queer, or questioning teenagers face different challenges when it comes to sexual abuse. GLBT youth are more likely to report sexual abuse, nearly 3 times more likely than other adolescents, dating violence, and unwanted forced sexual intercourse. Homeless GLBT youth report high rates of sexual assault. Rates of sexual assault by an unknown suspect is much higher for this population. But that's not all. All of these factors significantly impact their education. The risk of bullying is very high for GLBT youth. 90% of GLBT youth report being harassed or assaulted in the last year. 1 in 2 transgender individuals experience sexual abuse or assault. 78% of youth reported significant abuse at school, 31% by teachers. These youth are 8 times more likely to have attempted suicide. Up to 40% of all homeless youth in the U.S. identify as GLBT. When they are rejected at home, many GLBT youth are forced to leave their family. We know that 1/4 of our GLBT youth are forced out of their homes, and what do you do when you are 13 or 16 with no job and no education? How do you make money? 46% of gay and bisexual young homeless men and 23% of lesbian and bisexual homeless women reported exchanging sex for money and other needs. There's a heightened prevalence of sexual trafficking among transgender youth and GLBT homeless youth. Up to 35% of boys who are victims of commercial sexual trafficking identify as gay, bisexual, or transgender. GLBT youth face many challenges in asking for help. They may be afraid of those trying to help. They may be afraid of being outed. Sexual orientation may have been used by the suspect as coercion or a threat. They fear re-victimization. Transgender victims fear police harassment. They may have been refused treatment or have been harmed by inappropriate treatment in the past. They fear they will not be taken seriously. Do you and your agency promote an inclusive environment? Conduct a self-check. Have materials and resources available and visible. Use inclusive language. Show your comfort in serving this population. Caregivers need help exploring their feelings. They feel responsible. They feel grief, fear, and disappointment. Be there to focus on their strengths and on the love they have for their child. Acknowledge for parents the risk their child faces if they reject them. Let them know their response matters and tell them about the caregiver support groups. In working with GLBT youth, pay attention. Don't make assumptions. Ask them how they feel about their family, school, and their relationships. Assess their risk for self-harm. Connect them with supportive treatment. GLBTQ youth want you to talk to them. They want you to ask how they identify. They want you to know what they like to be called. They want you to care, and they need your help. Be an ally.